In the medical management of glaucoma, we discussed, first of all, offering the patient a treatment recommendation, and then the initial choice of IOP lowering medication, which is of course the prostaglandin analogs. So within that group of drugs, if we find that the patient continues to progress, there was a little discussion with regard to adjunctive agents or switching if the prostaglandins don't work. But a lot of the information centered around intraocular pressure, and the fact that we do a very poor job of sampling intraocular pressure because we do it every 3 months, for example, in a glaucoma patient. But we also talked about establishing baseline intraocular pressure using several readings, and then fixing a target pressure from that with an expectation of lowering it about 30% in newly diagnosed glaucoma patients. What I concluded with was to talk about some of the exciting new information with regard to medications that focus on the trabecular meshwork, which is an emerging area as the site and perhaps the initial insult in glaucoma. That the trabecular meshwork impairment of aqueous outflow is what causes the increase in intraocular pressure and then the consequent damage. So nitric oxide donating compounds specifically, as well as the Rho kinase inhibitors, were discussed with regard to their potential for enhancing aqueous outflow and improving intraocular pressure reduction.